Good morning. My name is Apoorva Sampat, and today's talk is based on the work I did during my internship at Genentech. I graduated earlier this year with my PhD in chemical engineering from the University of Wisconsin-Madison. I currently work at Dow in their Texas location. In this presentation, I will talk about a stochastic optimization approach we developed to capture the uncertainties associated with the supply planning of drug products. The motivation for this work was to develop a systematic decision-making framework in the complex space of drug supply. Drug production involves many uncertainties. First, there are uncertainties in product supply. This includes the equipment yield and also the yields associated with products getting rejected during quality inspections. At times, there can be manufacturing sites facing unplanned downtimes, which ultimately affect the product supply. There can also be variations in product demand depending on what stage of patent life the drug is in. For example, if the product is an early stage or end of the life stage drug, the demand variations are high. Next, the pharmaceutical industry has many regulatory restrictions on the manufacturing sites where a product can be sourced. There are some product markets which can only be served by a single manufacturing site, whereas there are other markets that can be dual sourced. In this work, a model captures these features and makes sure that the inventory levels are close to the safety stock. It also accounted for the capacity constraints and the planned downtimes of the manufacturing sites. Through this project, we also identified an opportunity to upgrade the workflow for the supply planners. At present, the decisions for drug production scheduling are made through manual spreadsheet calculations in the SAP APO systems. In this tool, the supply planners have to manually account for regulatory and capacity constraints, and when there is fluctuation in product demand or an unplanned downtime, they have to reschedule their entire production plan. This workflow leads to several inefficiencies since we are always trying to catch up with the uncertainties. With the optimization tool, our goal is to change this and provide a better decision-making tool. The vision is to have an optimization tool that takes product and site specific data and also accounts for the historical and forecast data explicitly to make production decisions that can hedge against the uncertainties in future. As you will see later in this presentation, the final production plan from the optimization model is more stable and does not require frequent rescheduling. Before going into the details of the model, let me give the problem statement. Given the data on production sites and the products they can manufacture, the goal is to satisfy the patient demand for these drugs and at the same time maintain the product inventory close to the safety stock levels. The decision variable in this setting is the production schedule, that is when, where, and how much of drug should be produced. This is how the modeling approach looks. First, we input data to the model. This involves product data such as the yield values, batch size, and the lead times. We also specify the site information such as the capacity, inventory targets, and shutdown periods for different manufacturing sites. Then we also consider the historical data for product yield and forecast data for product demand. We have developed a mathematical model that finds an optimal solution. We solve it in a programming language called Julia. I will go into the details about this model in the next few slides. The solution of this model tells us when, where, and how much to produce of a particular drug product. This is a multi-level graph view of the modeling framework. The smallest unit in this graph is the manufacturing site, for which we need to determine the production plan. All the sites are linked by the product demand that needs to be met. And this demand brings the synchronization between the sites. If you consider only one such modeling space, then we have a deterministic model. If you consider multiple scenarios of the uncertain parameters, then you start building a stochastic optimization model. And all these scenarios are linked by the production decisions that you make. In this case, it is the binary variable Z, which indicates if you should have a drug production at a given time at a particular site. This is the deterministic scheduling model for a single site. It is divided in two parts, the objective function and the constraints. The objective is to maintain the product inventory close to the safety stock levels. So any deviation from this target is penalized. So if you go below the critical level, you are heavily penalized. If you go below the safety stock, the penalty is lower. While if you go above the safety stock, the penalty is very less. In the constraints, there is an inventory balance equation where you keep a track of balancing all your products at every time point. Whatever you had at time t is equal to whatever you had just the time before, plus the fresh inventory that is produced, minus the inventory that is used to satisfy the demand. Next are some logic constraints that ensure that no two batches of a drug production overlap in time. Following that, we also have a batch duration logic, which captures the processing time of producing a drug and makes sure no other drug is being manufactured at the same time. Following that, it is easy to capture the planned shutdown and offered capacity limits of the manufacturing sites. This is the stochastic optimization model for the entire network, similar to the deterministic model that we saw in the previous slide. The difference now is that we seek to minimize the expected deviation of our inventory from the safety stock level. So we sum over all the scenarios K. And now, since we are considering the entire network, we also sum over all the nodes in the network. There is an additional term now that represents the cost associated with sending the production to an external manufacturing site. In the inventory balance, now we have an additional term that represents the yield from campaign manufacturing. Campaign manufacturing is when you have consecutive fills of the same product so that you save the time associated with equipment cleaning and changeover. The model can capture those decisions as well about whether you should do a single batch or a campaign batch. Next, we have the constraint to satisfy the product demand every week. This constraint helps to synchronize the production from all the manufacturing sites. Rest of the constraints in this model are similar to the previous model, just with the exception of this constraint for an unplanned downtime. One of the major challenges we faced when developing this model was capturing the impact of an unplanned downtime in mathematical form. The thing with unplanned downtime is that it is not known a priori, but I still need to schedule my filling decisions, knowing that some of them might not be executed if a downtime hits the plant during that period. How do you express that mathematically? My first suggestion was to have a multi-stage stochastic program where you solve the problem again after the plant has been hit by an unplanned downtime. But that was not a viable solution since Genentech's main goal was to reduce the amount of rescheduling and not increase it by having more recourse actions. Then we came up with a novel idea. We realized that the impact of a long downtime on the inventory projection is same as the impact of a fill loss. That is, you end up losing a batch. This impact is all we need to capture when making our production decisions. And there is a mathematical way of doing that. For every scenario, you define a series of ones and zeros. 1 indicates that the plant is not facing an unplanned downtime, while 0 indicates that the plant is facing an unplanned downtime on a given day. And using these blocks of ones and zeros, you can define a downtime factor. That is the product of these binaries. From here, the inventory balance can be easily updated to include these unplanned downtime factors in the model. Here is the summary of results we get. The table reports the total fills or batches for each product in scope at different production site, while the Gantt charts reveal more details about when and where to start a production fill. We compare these numbers against the plan in place by the APO system, which is the current planning tool used by the supply planners. The total number of fills are higher in case of the stochastic model compared to the APO plan. For example, the model recommends to have 23 fills of product P1 at site 1 compared to the APO plan of 22 fills. It recommends lower fills of product P4 at the first site, but higher number of fills at the second site. The higher number of fills is recommended in order to hedge against the uncertainties of low yield, high demand, and fill losses due to an unplanned downtime. Just to note, this is a very large problem involving millions of constraints and millions of variables, of which 4,000 variables are the binary decisions. So the next question that arises is, how does this difference in filling decisions translates to the inventory projections for the products, especially when an uncertainty realizes in future? I will begin the comparison with a simple example involving just one scenario. Consider the case when the demand for product P5 goes up by 12%. This in fact happened in the past due to the delay of a biosimilar, and the supply planners had to reschedule their production plans. Here I'm comparing how the plan proposed by the model, represented in green, compares to the plan proposed by the APO planning system, represented in the red. The x-axis is the timescale and the y-axis is the inventory level. The dotted lines indicate the critical and safety stock levels respectively. Our goal is to be as close to the safety stock level as possible. As you can see, the APO plan lingers around the critical stock level for most of the time and goes into backlog towards the end of the planning horizon. The supply planners would usually not let this happen, and they will reschedule their plan by expediting the processing and quality check times in order to meet the customer demand. Whereas if you were to implement the plan proposed by the model, you will reach safety stock levels by the end of the planning period without any need to reschedule the plan. Next, consider an example of site 2, which is very prone to unplanned downtimes. On average, there is one batch loss every quarter due to an unplanned downtime. We consider the scenario when you have 4 fill losses of product P4 at the second site. The APO plan in red goes into backlog multiple times in the year, whereas the model plan, which is indicated in green, is above the critical stock level for most of the planning horizon. And by the end of the horizon, it achieves a safety stock level. In our solution for the stochastic optimization model, we have considered 100 such scenarios for every product and site in terms of uncertain yield, demand, and unplanned downtime. Let's first take a look at how the APO plan would perform under these different scenarios. These are the inventory projections for product P1 and P4 under the 100 scenarios of yield, demand, and unplanned downtimes. The gray lines indicate the inventory projections under different scenarios. The blue line is the mean inventory projection, or the most probable inventory projection that you can expect if you stick to the plan in APO throughout the year. If the projections are below the red line, it means that the inventory is going into backlog. For both the products, there are multiple scenarios where we observe a backlog. The APO production plan is thus not robust under different uncertainties. Under the same scenarios, we analyze the performance of the stochastic model. The plots are much better in case of the decisions made using the solution of stochastic optimization model. To start, there are no scenarios where the inventory goes below zero for any products. Both the product P1 and P4 are projected to achieve safety stock levels by the end of the planning horizon. These 100 scenarios capture the best and the worst case possibilities and everything in between. Also, in majority of the scenarios, the inventory is above the critical stock level, even for the worst case. Compared to the previous projection, the solution is more robust and does not require rescheduling. I would like to conclude this talk by acknowledging our collaborators. Victor Saucedo and Ramya from Genentech have played an instrumental role in championing this project at the company. I want to thank Ranjit, whose work during the first phase of this project acted as a successful proof of concept and allowed me to expand this work by capturing different uncertainties and covering different manufacturing sites. I also want to thank our academic advisor, Victor Zavala, for mentoring and encouraging us to work on this project during the course of the PhD studies. Finally, I want to thank the TWCCC conference for enabling this collaboration between academia and industry. With this, I will end the talk. Please feel free to reach out if you have any questions or comments.